My name is Aniceta Kiriga from Kenya, Tharaka Nithi County. I'm the Executive Director of Tharaka Women's Welfare Program. Tharaka Welfare Program got into partnership with Women's Global Education Project in 2007 because we have a common priority or a common goal to eradicate poverty through girls' education. Since then, we have been collaborating and we have done so much together, and we are happy about the partnership so far. Coronavirus got into Kenya about 2-3 months ago, and the government has tried to respond to it in different ways. They have put restriction, for example, walking around or moving around from 7 p.m. to 5 a.m. and also locking down the counties that are at risk, those that have already the COVID-19. They are also educating the public and making sure the health policies are being adhered to by the public to the latter. They are educating the public also on what they should do to avoid this virus. Things like washing hands, keeping distance, not touching their faces, wearing masks, and all those other things that the ministry has advised people to do. That is what they are enforcing. The other thing is they are trying to help the public in supplying a few things. We have seen a few water tanks in the markets for public to wash their hands. We have seen a few sanitizers being given out by some of the people in the government. We have also seen few masks being also given out to the public, which are not available for everybody. We haven't seen food so far being supplied, and that is one of the needs during this pandemic, because people cannot walk out freely, go to look for food. One, the markets are closed. Two, the lockdown stops people from moving out or inside to get essential issues. So if you don't have this or that in your county, you remain without it. No fruits, no vegetables, no people to come and buy chicken or food crops that we grow here, which are our cash crops. And that has brought a lot of problems. It has caused the hunger that we have, because we sold all the food stuff that we had before this. What we are anticipating is to have the virus gone so that we can sell what is in the farms now, which has not matured yet. And the money was spent on school fees, most of it, on health issues, on other basic needs like clothing and food. And therefore, when the schools were closed, parents did not have food in the house because the money they paid in school was to cater for the girls for that period. There are schedules that the government has put out there for children to follow. There is a lot of teaching through the media, but here, due to poverty, very few homes have radios and televisions where our girls can listen to the lessons when they are at home. They also don't have enough for their personal effects like sanitary pads and other essentials, because sometimes parents afford for them when they go to school, and when they closed, some left theirs in school because they thought it will not take long, but now they are caught up by nature again, and some parents cannot afford these things. So far, we don't have any COVID-19 case in our region, but we are afraid it could come in because we have Kitui, which is our neighbor, and they have the virus. We have Isiolo County, which is also our neighbor on the other side, and people from these counties intermingle, so it's easy for the virus to be spread. We want to thank the Women's Global Education Project for the support they have given us, because through the program we have been able to supply the families with little food that they afforded. So we have been able to give 500 adult literacy women food. We have also been able to give out 200 radios and lanterns to our girls so that they can get the channels and get the teachings that the ministry is posting through the media to prepare themselves for the exams, and also for the lanterns to provide lighting at home so that in the evening they can study. I've also given soap to make sure they are keeping clean, they are washing their hands so that they are not affected by the virus. We have also given out sanitary pads to our girls because they don't have them, teaching them on how to keep the distances and always to stay at home, and how to keep hygiene, high levels of hygiene. We are in contact with the parents and the girls through WhatsApp and on phone to know their welfare, because that is our first and foremost thing that we do, to make sure they are safe and sound before we do these other things. We cannot promise of our future plans because we don't know the duration this is going to take, but for what we get, we shall flexibly address the issues that we can, that will help our girls and our society move on as we move on with this pandemic. Thank you very much, and keep safe.